Today we are going to be talking about the typical progression seen when examining patients suffering from ALS. It's important to preface by saying that ALS is a non-linear disease, so you cannot put a harsh timeline on it. For example, some people die within 1 year of having ALS, while others have a much longer lifespan, like the famous Stephen Hawking, who lived with the disease for 55 years. However, the typical individual experiences the progression of the disease over 3 to 5 years, and that's what we will be focusing on today. It's important to note that many people who will go on to be diagnosed with ALS will experience its symptoms in a less severe manner long before the formal diagnosis is made, and that's what this early stage focuses on. These early symptoms include weak and tight muscles, cramping and twitching, fatigue, poor balance, and stumbling. There are 2 types of early onset. The first is spinal onset, which starts with the limbs weakening, and the second is bulbar onset, which focuses on the face and neck and starts with trouble speaking and eating. Moving on to the middle stage, this stage is typically broken into 3 regions, but we're going to lump them together and talk about them all for the purpose of this video. Muscle atrophy that was once limited in the individual to one area will spread to other muscles. Muscles can become paralyzed and even shorten, making joints impossible to straighten. This eventually leads to the face and neck, trunk, core, and limbs of the body becoming extremely weak and causes many individuals to need a wheelchair as they lose much strength, coordination, and balance, and paralyzation occurs. Breathing muscles also deteriorate, and lung capacity declines, which leads to trouble breathing, exhaustion, and higher risk of respiratory illness. This stage also brings on emotional and psychological challenges, as the individual loses a lot of independence and typically has to rely on caregivers just to get through their day-to-day tasks. After the middle stage fully progresses, it is typical that the individual with ALS will then need a gastrostomy. This is the process where a feeding tube is inserted into the stomach so the patient can be fed while their swallowing is compromised from the disease, as you can see in this video. Now we'll move on to the late stage of ALS. Although there is hope for a cure of ALS, it is still currently a fatal disease. As the disease progresses, voluntary muscles are paralyzed, respiration is poor and can lead to pneumonia, causing the need for a ventilator, and talking and swallowing become impossible, as well as mobility being extremely limited. Although medications can relieve anxiety, discomfort, and fear in terms of the illness, most deaths occur due to respiratory failure. Typically, when patients are given a prognosis of 6 months or less, they are eligible to take up hospice care in order to ensure that when it is time, the patient has the most comfortable, peaceful, and respectful experience when they die. These stages are important to note because, especially if somebody in your life is dealing with ALS, you want to have an idea of what to expect. But it is also important for the individual experiencing the disease to have an idea so that they can best prepare themselves for their journey throughout the disorder. It is always important to note that progression is very unique to the individual, so this isn't accurate for everybody, but this is what we typically see throughout ALS progression.